you did sometimes, seeing eyes of mine. Love, love, love.
Hello everyone, I'm Raquel Palma Rabaca. I'm here to share to you the topic which is all about the English for medical purpose. What is English for medical purpose? English for medical purpose is a branch of ESP that covers the English language which healthcare professionals need to be able to practice safely and confidently. So it is also refers to the teaching of English for doctors, nurses, and other personnel in the medical professions. Now let's discuss the difference between the English for medical purpose and the general English. So the general English, it is the English where the people used it, especially the conversation, vocabulary, and the grammar. While the English for medical purpose, it is used for the medical practitioners which be able to have the successful performance at work or the optimum effectiveness of medical training. Now, I will inform you the importance of English for medical purpose. So language has always been a matter of concern. With globalization, with fall of technologies, and people desires to be economically fit are increasing. And they are in search of better opportunities to improve their lives. Now we are a part of the people. We must accept that we are conscious of our language, or we should be aware of how important to know the English. As far as the medicine field is concerned, there is no recognized discipline that is called medical linguistics. But perhaps there ought to be one. True that the language of medicine offers some interviewing challenges, both for the patients as well as the doctors. We as a human beings have now entered into the era where English for medical is important aspects of our life, especially to the medical practitioners, because they have chosen one common language for communication within themselves and with their patients. Now, let's proceed to the origin of English for medical purpose. So the medical revolution began approximately around the 1800s until the 20th century. Its main purpose was to help and restore a world that was heading toward destruction. And the first female physician in the Philippines was Dr. Honoria Costa Sison. She was born on December 30, 1888, and she died on January 19, 1970. She was the first Filipino woman to become a doctor. She studied at Women's Medical College of Pennsylvania. Now let's proceed to the terminologies of English for medical purpose. Abdominos, having a large belly. Apnea, a disorder that causes you to stop breathing briefly, often while you sleep. Alopecia, partial or complete loss of hair. Amenorrhea, absence of suppression of menstrual flow. Anorexia, a prolonged disorder of eating due to loss of appetite. Anorrhea, inability to urinate. Cardiomegaly, an abnormal enlargement of the heart. Scrub up, carefully wash hands before and after seeing a patient. Scrubs, plain uniform, usually green, white, or blue, worn by medical professionals. Hypotension, low blood pressure. Oncologist, oncologist is a doctor who's an expert of cancer.